Hi, I'm Mark Zampatti from the Cryo Sports Treatment Clinic. Today I want to show you a piece of equipment, computerised technology called the Human Track. We use this to determine someone's ability to control their legs, their knees, their hips, their ankles when they're doing important functional movements like squatting. Squatting is a normal movement that we use when we land from jumping, when we're taking off from jumping, and the alignment of our knee is important when we're returning from injuries like a knee reconstruction, medial ligament injury. If our knee goes inwards too much, then that can create re-injury or potentially re-rupture if you've had an anterior cruciate ligament injury. So we want to look at the alignment of the knee and the depth that we can squat. The Human Track, basically using gyroscope sensors on the wrists and the ankles, and a video capture, this camera over here, so just here, basically films me while I'm doing the assessment. So if you have a look at the screen, we've got a computer here that we can actually put up onto our television screen. You can see on the screen that there's a number of dots. The dots are around the ankles, the dots around the knees here, and then there's lines across the hip, across the chest, and even at eye level. These markers help to determine the angles that are basically being measured, and we can use this data to look and see whether we've got symmetry of movement, the depth of movement, the joint angles, even the position of the spine. Fantastic data to help us to determine whether someone is doing well or needs work. So it's a way of measuring progress, but also we use it in our return to sport and ticking those boxes along the way in the rehab. So I'm just going to demonstrate first two-legged squat, and then we'll also do a single leg squat. So if we push capture on the camera there, on the computer, we basically do 3 squats. So 1, 2, oh, lost my balance, 3. And then we push stop. Okay. Just stop now. Now I'm going to demonstrate how we look at the single leg squat. So this time we're effectively assessing the unaffected leg, which for me is my right leg, compared to the affected leg, which is my left leg. So we're going to have a look at the right leg first, again doing 3 single leg squats. So if we just push capture on the screen there, stand on the right leg and do 3 single leg squats. And then we push stop. Okay, now we're going to push capture left, so cross to the left one. And again, 3 single leg squats. And stop. And you can see the quality of my movement on that left side was nowhere near as good as the right side. I have had a knee reconstruction on this side and a relatively recent ankle injury. So the Human Track, fantastic resource that we can now use in the clinic to assist us in determining symmetry, how well someone can squat, what's the angle like at the knee, is the knee buckling inwards or outwards. Particularly don't want to see knees buckling inwards because that puts you at significant risk of an anterior cruciate ligament injury or a medial ligament injury. Thanks for your time. I'm just going to show you now what we get after we've finished. The computer generates a report and basically shows us the angles and the forces. So the report here has snapshot pictures of the 3 squats that I've done here, and it actually shows the angle that I've achieved. It also shows whether I'm in balance, left versus right or right versus left. When we go down to the single leg squats, you can see a lot more variation. You can see here on the left-sided one that, especially the third one, there's not very good control there. There's big differences in the amount of flexion, 63, 76 and 29 with the third one. The angles inwards and outwards. The valgus force here is the one that determines risk with ACLs. Mine's very low, but I have had an osteotomy where my leg's been realigned on that side. If we compare the left side there to the right side, I'm much more symmetrical with that right side. The angles are more consistent and yeah, look much smoother.